Hello, everyone. Week 2, Abnormal Psychology. I'm Michaela. Question 1. Discuss how your views of depression have either shifted and or were validated after reading The Anatomy of Melancholy. Um, According to the article, The Anatomy of Melancholy, recovery from depression depends enormously on support, and Solomon also stated that the depressives I've met who have done the best were cushioned with love. This supported my current view on depression and the importance of being surrounded by others. It just goes to show how taking the hard love approach is not the recommended approach to take. And my view of how depression is an internalizing disorder and how it can impact social involvement and isolation was also supported while reading the article. As recalled in the article, it is hard to talk to friends about depression during depression. There's solace to be found in strangers. So I could not help but think about the importance of outside providers and clinicians. It's essential for patients to be able to speak openly about their feelings without feeling like they're being judged. And sometimes, family and friends can do that, unfortunately. And for example, they may avoid opening up to their friends and family, like I just said. So I cannot imagine if psychologists and therapists were no longer available to provide mental health support through telepsychology, or also known as online therapy, especially during a time like this, like COVID-19. So many Americans right now are experiencing all different types of loss, and they need lots of support. So, as described in the article in 1988, it was projected that by 2020, the researchers at Harvard and the World Health Organization that only respiratory infections, diarrhea, and newborn infections cost more years of useful life than major depression. So, not surprisingly, this study also highlighted how at that time a particular type of depression had higher morbidity rate than heart disease or cancer. And lastly, this article also validated how my view of depression is an illness. It's not entirely biological or psychologically driven. Andrew Solomon actually suggested that resolving the biological and the psychological understanding of depression is as difficult as reconciling predestination and free will. So I cannot help but think about the many biological and psychological factors that impact one's experience of depression. So, as stated by the author, I did not experience depression. Until I pretty much had solved my problems, and it was not until my life was finally in order when depression came slinking in and spoiled everything. So this pretty much suggests that depression is caused more than just by psychological factors, and they can appear at any time in one's life. Okay. Question number 2. Discuss how your views of schizophrenia have either shifted and or were validated after reading the collected schizophrenias. Prior to reading this week's this week's readings on schizophrenia, I learned about the disorder, or had, learned about the disorder previously through movie depictions and online classes and whatnot, or previous classes and whatnot. I learned from the reading the collected schizophrenia's high functioning that the people who live successfully with schizophrenia have positive prognostic features, which include premorbid functioning, later onset, sudden symptom onset, higher education, good support system, early diagnosis and treatment, medical adherence, and longer periods of minimal or absent symptoms between episodes. So this basically means that people who have schizophrenia can navigate life somewhat successfully with certain presentations of the illness. However, most presentations and most people are not as fortunate. My view on schizophrenia has been shifted after reading the collected schizophrenias toward a pathology of the possessed, because I had not viewed the illness uh, as an illness of deletion until now. The author describes schizophrenia as, like Alzheimer's, an illness not of accumulation but of replacement and deletion, and rather than obscuring the previously known person, this disease is to some degree eliminates that person. So I hadn't really thought of it until it was explained that way. Also, my perspective has shifted after reading this specific analogy from the collected schizophrenias. Depression is often compared to diabetes. In other words, it's not your fault if you get it, and you'll be fine if you take care of it. Schizophrenia, on the other hand, is compared to Alzheimer's. It is not your fault if you get it, but there's no fixing it, and though you may not intend to be a burden, you will still be one until you die. So, as morbid as that may sound, it is fairly difficult for people with schizophrenia to live on their own, and unfortunately, they will not be as successful in approaching or fighting their illness by themselves and on their own. And finally, question number 3: should minors be charged as adults in the criminal justice system? Yes or no? Explain your rationale. So this can be such a controversial topic for so many reasons. However, my overall point of view is no, they should not be criminally charged as minors. In my personal opinion, we all do a lot of stupid things when we're kids, no matter how major or minor. I feel like we shouldn't be punished to such a degree until we're fully developed. And what I mean by that is till our brains are fully developed and are capable of making good decisions and filtering out irrational thoughts. And this age, I think, is a lot closer to 21 than, 18 years of age, as studies show. So, as discussed in No Remorse, should a teenager be given a life sentence? Teenage years are an emotional time, and adolescents are at a high risk for developing depression and anxiety. I remember personally as a teenager all of the irrational thoughts that I think most of us had to endure. A lot of the common ones, more common ones being, I'm a loser, I'm ugly, I hate my body, or I'll never be anything, or no one loves me. Those are just the common ones. But what about the more intense ones? Like in the reading, for example, like Dakota. Dakota's irrational thoughts started as a 14-year-old male after a series of unfortunate events that led him to believe that, he would always be a failure and no one would miss him. Common, minor, irrational thoughts. But this article, how those irrational thoughts can build up into something more severe, like killing his grandfather. So this article is a great example of how untreated and built up emotional distress and irrational thoughts can expand and fester into more powerful negative feelings associated with violence and pent-up anger and rage. But yeah, that's pretty much it. I hope everybody had a good holiday season, and thanks for sticking around to watch my video.